I wanted to first give the update, what's happening today, basically. So the last remaining passengers and the crew who are disembarking will have disembarked by the end of today. They are departing Canary Islands by specially arranged flights. Matteo will speak a little bit about that. Nobody is traveling on commercial flights, and I know there's concern about that, which is why we mentioned it yesterday. We're mentioning it again today as well. WHO's Director General, Dr. Tedros, and other WHO staff are still in Tenerife. Some of them are moving onwards to Madrid today. We have had a team of 8 WHO staff in Tenerife coordinating with the Spanish authorities and others on site, and that's exactly what Matteo will speak about. 30-plus crew members, a little bit more than 30 as I understand, will remain on the ship and bring that ship onwards to Rotterdam, which is travel of a few days. Olivier, can you just give us, and just quickly, because I want to get to Matteo as quickly as possible, just what the latest case count is?
Thanks, Nika. So quickly, as of today, we've got 9 cases. 7 of whom are confirmed, and we've got 3 deaths among them. The latest case was reported by France among one of the passengers who disembarked yesterday, is currently in isolation and has been confirmed today. Not counted in this total is one person from the ship who was repatriated and had an inconclusive laboratory result. We are awaiting further confirmation, hopefully later today, to get the clarity on numbers.
So the latest case, we say cases, but these are people who are sick and very worried. But the latest person who's counted as a case was reported by the French. We usually don't mention nationalities, but because there might be a bit of confusion, we are mentioning that the person is French and was announced by the French Ministry of Health. So that brings the case count to 9, and then there's one inconclusive that we haven't put in that case count at this point. I'll come back to you, Olivier, on some questions around epidemiology. But first I want to go to Matteo, who, as I said, is with the ERCC EU Liaison Officer. He's with EU Civil Protection. He's in Tenerife and the Canary Islands. Matteo, can you tell us what your role is there?
Yes, so good afternoon. Sorry, it's a very windy day here in Tenerife, so I think and I hope that you can hear me well. Indeed, I'm Matteo Noce. I'm the liaison officer from the ERCC Emergency Response Coordination Center of the European Civil Protection Mechanism. My role here is to ensure support to coordination operations and to ensure the high level of coordination between the Emergency Response Coordination Center and the stakeholders, in particular the Spanish authorities, Ministry of Health, and of course WHO. It's a complex operation, so many stakeholders are involved in this, and there is a clear need to make sure that everything is going smoothly. To you.
Yep. Chris, can I just ask you to turn the room volume up a little bit? It's hard to hear Matteo. Matteo, we can hear you. I know there's wind, but it's we can still hear you. So you were talking about the coordination. You're coordinating in particular with Spanish officials. You mentioned coordinating with WHO officials who are on the ground and others. And where have you been located these last few days? Where have you spent your time?
Yeah, indeed, that's correct. During the last 2 days, I was in the port, connected for now. And this is the place in which it's part of the most important place. I think that you can see just behind me the ship. Probably as aware indeed, this is the place in which the disembarkation of the passengers is from here, sorry, there is now also a plane. From here, are transferred today according to the different flights. This is in the level of coordination with passengers, particularly because the European Civil Protection mechanism is coordinating in particular the from
Matteo?
here to the...
Matteo,
yes.
Can I ask you maybe to hold the microphone within your collar to protect it from the wind a little bit? Because I think the noise cancellation is actually canceling a lot of your voice, and we're missing some of what you're saying. And maybe just put your hand around the microphone too. That might help. Okay, so you were saying, when we spoke earlier anyways, you were explaining that you've been at the port, you've been at the airport, you've been doing a lot of that liaison work between the incoming flights you're concentrated on the EU countries, and also focused on sharing of information so that those flights go as smoothly as possible. We'll just try coming back to you one more time. Can you tell me what type of information you've been sharing, what your liaison role is on which type of information?
Sure. I hope that now the quality is getting better. When it comes to the information, actually, there are many pieces of information we need to assess in a real time, and that's the reason why there is a need to have a physical presence here, in particular when it comes to the timing of the different operations. This is probably the most important, but on top of this, of course, many considerations related to the epidemiological situation and also the clinical status of the different passengers, because we have seen that most of the passengers do not need to have clinical assistance, even though in case there will be some clinical things we are ready to step in and clarify the first level of responses, of course, managed, coordinated by the local authorities, in particular the Spanish Ministry of Health. We can intervene in case there is to ensure transfer in the European countries of critical care capacity provided. We also have air ambulance, air ambulance,
Thank you, Matteo. Matteo, I think it's really, we've been a victim of the air today, of the wind, and it's really difficult to hear you. I'm going to share a few points, though, that I learned from you earlier on. So one of the things the EU is coordinating in this case is if there was an emergency on top of an emergency. So you had brought in an air ambulance in case that was needed, in case anybody needed immediate evacuation, rather than the other process of repatriation that had been organized as well. You mentioned that you had organized, you had done the EC liaison work on 6 flights, 4 yesterday and 2 today, and so that's the total of what the ERCC was going to be focused on. So I'm really sorry about the sound quality, but one of the reasons we wanted to have Matteo on is to really show, when we talk about this being a coordination across levels, across countries, across agencies, that's an example of the kind of support that's out there. Thank you so much, Matteo. So coming back to you, Olivier, to talk a little bit more about epidemiology. I think one thing people might be wondering is, we have for the past week, we started working on this last Saturday when we had the first official alert. We've been talking about all the measures that have been put in place to stop spread, all the testing that was happening, all the research, the investigation into how this outbreak started. Some people might be wondering, why are we still seeing cases? Does that mean your control work wasn't effective? Does that mean people weren't following the protocols? So can you, and that's not the reason why there's still cases. So can you explain why we are still seeing cases?
Thanks, Nika. Very good question. We know the incubation period for hantavirus and Andes virus is very long. On average, people who acquired the virus will only develop symptoms about 3 weeks later. So the average is about 3 weeks. It can be as long as 40, maybe 40 to 45 days. That is also why that period of follow-up is so long, because people can still develop symptoms much later on. We know that there's been transmission on the ship. It's great that the disembarkation process yesterday went smoothly. It was very important to have that level of coordination across, and really encouraging to see that it went well and that people are now also in being quarantined at home and facilities and also being followed up. It will be important. Difficult times for people who were on the ship, knowing that they may have been exposed, they're not sure, and so they will remain vigilant for the next few days. But that incubation period means that we can see cases again coming up in the next few days, perhaps even next week, and that's why we need to remain vigilant, make sure that at the first signs and symptoms, people are being recognized, isolated, and taken care of.
Because we know there's a better chance of having a better course of the disease if you have received the treatment right from the beginning. There's no specific treatment, but we do, what the healthcare workers do is they focus on the symptoms and making sure the person's body is in as good shape as possible to fight the disease. So we've been talking about 6 weeks as that longer moment. So from the time when the first person on board was ill and may have been passing it along, we don't expect everyone to get sick, obviously, but the people who may already have been exposed could be up until 6 weeks before they become sick, as it were. And so what is happening in that period of up until 6 weeks? We spoke about a countdown starting from yesterday of 42 days for each person who disembarked. What is happening within those 42 days to make sure they are protected and people around them are protected as well?
So the recommendation is for people to be essentially isolate or contained in a place where they don't have actually contact with other people. And so it's either home quarantine or facility quarantine. Why we do quarantine or recommend quarantine is because actually people are infectious at the very start of illness. So in the first few days, in the first few moments of illness is when the infectiousness is highest. This is also sometimes when it's a bit difficult to recognize the symptoms, because initial symptoms could be mild symptoms, initially some fatigue, maybe mild fever, before symptoms sometimes deteriorate, unfortunately. And so, but that's also when people are most infectious. So not wanting to wait for that to happen to then isolate individuals, the recommendation is to go for quarantine so that we know that they will not infect others when symptoms occur. So that's the whole rationale around quarantine, also being perhaps a little bit stricter because this is a well-confined outbreak for now, and we want to make sure that the outbreak doesn't spread further.
The idea as well in that, so you're saying for that quarantine period, that whole time is really to make sure they're not interacting with other people, but they're also not isolated and by themselves. They're being followed very closely by healthcare workers. In terms of transmission, this is a question we've seen a lot. You did just address it. So what we've known from previous outbreaks, that people are most contagious when they start to feel ill. That's when the viral load, the amount of virus in them is higher, and therefore they could transmit it literally out. But you're also saying even a couple of days before they really feel those symptoms, they might also be contagious, essentially. And that's why there's that idea to keep them away from other people the whole time.
Yes, and we need to take some precaution measures right now because there's some evidence around hantavirus and antivirus. There are a few outbreaks we can have, we gathered evidence from, particularly in Argentina. But there's not a great wealth of information. We know that it generally spreads through close contact. We don't know how much it might spread just before people develop symptoms. It might be just on the cusp, or just when they're symptomatic. And so because of all of that, we need to apply some precautionary principles and make sure that on the chance that people may pass the disease on even just before they become symptomatic, that they are in a context where they wouldn't pass it to others.
WHO has developed, shared with member states, and also published, so you can go on the website and find them, guidance on how to manage contacts, as you said as well, and also this whole process for in this outbreak, how to manage the people who the disembarkation process, and then onwards, how we recommend they be managed when they're in their home countries. Not all countries are following WHO guidance to the letter, nor do we expect them to. It's embedded in the word guidance. It's a guide. So people, some journalists are sometimes asking us, how do you feel? What's your comment on the fact that countries aren't doing exactly what WHO's guidance says? So as an epidemiologist, what do you say to that?
Well, I think you covered it. So guidance is it's a guide. It's some steer. We provide some guidance at the global level. Not all countries are the same in terms of their context, in terms of their public health infrastructure, in terms of the risk and the individual risk management around specific contacts. So a guidance can't cater for all eventualities. And so we still need to apply some good public health judgment when something happens that perhaps is not exactly covered in the guidance. But we know what we want to do with the guidance. We want to make sure that this outbreak doesn't spread further. We want to contain it. We know that the boat and the ship was an environment that was conducive for transmission. We know that generally hantavirus doesn't spread very well in the community otherwise. And so the measures that are being put in place right now is trying to make sure that not only the passengers are in the safest hands as possible, for themselves in terms of their clinical care, for their loved ones, and make sure that they don't transmit it on. But also the whole point right now is really trying to stem this. And so there's guidance that is being issued. The guidance is as specific as it can be, knowing it's global, but also knowing that it does inevitably need to be adapted to a local context. It's also dynamic. There's more that is being learned through this outbreak as we learn more about transmission, learn more about how cases were acquiring the infection, as we know more about the epidemiology, the phylogenetics, that we understand a little bit more about the clinical picture. So guidance is dynamic, will possibly be updated, and certainly is a live document, so that will be, updated when it needs to be. But to your point, it needs to be contextualized, and it's as specific as it can be, and then needs to be adapted to the public health context, the infrastructure, the capacity for different countries to implement, for example, facility versus home quarantine, testing, and also and all of that.
I see that Matteo may have been able to get a slightly quieter spot, so we might go back to him in a second. I just want to clarify on one thing. You said that the ship had conditions that were conducive to spread. That's because it is a ship, essentially.
It is a ship, and so there's been other outbreaks on cruise ships. Norovirus is a good example that can spread really quickly on cruise ships. It's an environment where people live together in a fairly enclosed space. I understand it's a fairly comfortable ship, it's a fairly luxurious ship, but nonetheless, people live there in a fairly confined, artificial space. So it is conducive to transmission. So we are dealing with an environment that is not your common environment for spread. And so that's why also we likely seeing more spread than we would see otherwise. And that has been seen in the past in some of the outbreaks of hantavirus, which generally sort of die out fairly quickly, are quickly controlled. Here we're dealing with a situation where perhaps there's been a bit more transmission on the ship because of the environment. That environment has been now contained with the evacuation of passengers and disembarkation of passengers yesterday as well. We are now in a much better place to actually control the risk moving forward. And that's a really important step in terms of how we control this.
And when you say confined space, it's also because people are interacting with each other over and over again, the same people interacting with each other in these limited
several
spaces.
Days, several weeks, not just in cabins, but you've got shared restaurants, shared bathrooms, shared activities, shared space that you would not otherwise have in a normal circumstance.
Thank you. So we'll try one more time. We're going to go back to Matteo. He's the Emergency Response Coordination Center EU Liaison Officer with the EU Civil Protection. He's in Tenerife, has been working closely with WHO. Can you just tell us, Matteo, now your video looks frozen, but apparently your sound is better, so let's see. Can you just tell us when you will know this is over, when you will know that your support is done in Tenerife? We don't hear the sound, Chris. You have to unmute, Matteo. Yes, go ahead.
Okay, thank you. And sorry once again for this inconvenience. Yes, when this emergency will be over, actually, we are here just again to clarify once again that we are supporting the local authorities. So the decision in terms of emergency management is with the Spanish authorities in this case. So we will support the Spanish authorities until the moment they need to receive support. For this specific case, we guess that after the ship will leave, the support here in Tenerife will be basically finished. So, but in this, we have indeed to decide the next step with the Spanish Minister of Health and the Civil Protection.
Thank you, Matteo. I'm glad we could hear you that time. Thank you so much. Thank you for your support as well. Thank you for the work that you are doing and all your colleagues as well. So that's it for us today. The next thing that happens, as we understand it, is the ship will be moving onwards to Rotterdam with a crew of some 30-odd people as well, and then it will be their chance to disembark finally also. We think there's going to be a press conference moment later today with the Spanish authorities, and tomorrow as well. They're also doing an excellent job of keeping everyone updated on this, and that's what we're trying to do from our side. So once again, I want to thank Dr. Olivier Le Polain, Unit Head, Epidemiology and Analytics for Response here at the World Health Organization in Geneva. Thank you.
So much.
And we thank also to Dr. Matteo Nocci, who's the colleague you heard from the ERCC, who is an ERCC EU liaison officer. He's with EU Civil Protection. We may do this again tomorrow. We'll see. We aim to do it around 4 or 5 o'clock. If it's still needed, we will see you again tomorrow. Thanks so much.